अपना गोल्ड मनप्पुरम लॉकर में रखो। सब लोग ऐसा स्मार्ट बनो, कहीं किधर भी स्मार्ट बन जाए।
मनप्पुरम ऑनलाइन गोल्ड लोन स्मार्ट है।
uniquetimes, premium business lifestyle magazine.
Breast cancer being the commonest cancer among the women, and it is one of the commonest killer in the world today. How important it is to us, all the women. Mind you, men also can get breast cancer. And every cancer in the world are increasing. Kerala being number 2 in the total incidence of cancer in India. Thanks to the development, thanks to the economical development, we assume Western lifestyle and changing from the traditional way of life. In fact, women are the fulcrum of the family. They spend extra 8 hours for the family, but not paid. And so the whole scenario of white-collar job, change in dietary habits, and as you know, hormone estrogen is the number 1 causative factor for breast cancer. Obviously, all women have got estrogen. Apart from all these things, today, women are coming with lung cancer, non-smokers. So common today, so is gastric cancer, colon cancer, and even tongue cancer. So what is so important about breast cancer? As you know, breasts are the symbol of femininity. And you can imagine the psychological trauma that a woman is going to face when the sad story is going to come out that you may have to lose your breast for treating breast cancer. When beauty is linked to a cancer, the loss is like an organ. So therefore, we must understand that when the world changed and more incidents in cancer came, so also developments occurred in the field of basic science in oncology, and so many newer developments appeared in the world. So those tumors which were thought to be incurable are currently taken into as curable cancers because of the changes and understanding and gene analysis and so on and so forth. So what is the most important message that we should take forward? That breast cancer is also a preventable disease. That every woman should realize. They change their lifestyle. If they are able to change their dietary habits, if they are able to reduce the fat in the body, if they are able to readjust their dietary habits, and as I said in the beginning, woman is the fulcrum of the family. Therefore, the entire health of the family, as per Kerala standard or an Indian standard, remains in the hands of the woman who makes the decisions in the kitchen. So, cancer prevention starts in the kitchen. And there we have to understand what dietary interventions we should do and how to detect cancer early. And breast cancer is one cancer which can be picked up by the patient even before it becomes a big issue to the woman. That's called self-examination. In those who are menstruating or premenopausal women, breast examination is done in the mid-cycle and not immediately pre or post-menstruation. Those who attain menopause, any day is a convenient day in a month. So self-examination as per world standards and world data can detect more than 60 to 70% of the malignancy in the early stage, which means curable. Similarly, there's a screening program called mammography, and that can detect the disease more than 90% of the situation, 90 to 95%. More than 80% of the women in Kerala are employed, either in IT world or in other areas, wherever, which means your employer has got as a duty. That's why Ajit has brought in this big meeting. Most of you who are honored are having some firm or other under your custody. So all your women employees need to be empowered. And that is through giving the awareness and education so that we'll have a bright future, a bright Kerala, and more enterprising results for the future. Thank you very much for your patient hearing, and good luck for this conference.